Miss Dasher. My name is Mikey. I'm going to be your student nurse for today. And today we're going to be doing a head-to-toe assessment on you. And throughout the head-to-toe assessment, if at any time you feel any pain or tenderness, just let me know. We're also going to be very up close and personal, so if at any time you're uncomfortable, also let me know. So we're going to start by providing you some privacy. I'm going to check your name badge. Can you verify your name and date of birth for me, please?
Shakira Dasher, 21176.
Okay, great. And can you tell me where you are?
Yes, I'm at Fortis College.
Yes, do you know why you're here?
Yes, for a head-to-toe assessment.
And what is today's date?
March 19, 2020.
Great. Patient is alert and oriented times 4. So we're going to start by doing the Fallon's test. I'm going to have you hold your hands back to back like this for 60 seconds. And we're going to start now. While you do that, I'm going to read off your vital signs that were taken earlier. Your blood sugar is 128/32, taken in your right arm. Your pulse is 78, radially 2+ force. Your respirations was 16 with normal depth, regular rhythm. Your temperature was 98.7 orally. Your oxygen was 99% on room air. Your Snellen chart vision, which is your eyesight, was 20/30 bilaterally with corrective lenses. Now, are you in any pain at all right now?
No.
On a scale of 1 to 10, how would you rate your pain?
0.
Okay, great. And have you had a recent cough, chest pain, shortness of breath?
No.
Do you smoke?
No.
Have you had a history of TB, pneumonia?
No.
What about respiratory infection?
No.
And have you had your flu shot?
No.
Okay, great. You're gonna hold that just for 10 more seconds. Okay, great, you're done. So, do you feel any numbness or tingling after that?
No.
Okay, so now we're going to do what is called the Tennel sign. This is also checks for carpal tunnel. Just tell me if you feel any numbness or tingling.
No.
Okay, how about in this wrist?
No.
Okay, great. Now looking at your hands, I see no edema, no redness, no crepitus felt. Your hands are warm and dry to touch. Nails are short, nail beds are clean, no signs of clubbing. Okay. Capillary refill is less than 2 seconds. Also, no crepitus felt over here. No lumps or lesions or bruises, no edema. Skin is warm to dry to touch. Okay, so now looking at your head is normal cephalic. Your hair is evenly distributed. No signs of infestation. Your facial features are symmetrical. Okay, so we're just gonna palpate. No lumps or lesions felt. No edema. Okay, so now we're gonna come down to your temporal arteries. And your temporal artery pulse is a 2+ bilaterally. Any pain or tenderness?
No.
Okay, great. And now we're gonna go down to your TMJ. And so I'm gonna have you open and close your mouth. Okay, move it from side to side. Okay, no popping, clicking, or crepitus felt. I'm gonna check your muscular mastication. Can I get you to bite down for me and hold it? Okay, muscular mastication strength is a 5 out of 5. Now we're gonna go to your lymph nodes. We're gonna start with pre-auricular, post-auricular, occipital. I'm gonna turn to the side just a little. Jugulo-digastric. Other side, jugulo-digastric. We're gonna come down to submandibular. We're gonna check your submental. I'm gonna have you turn your head to the side. And we're gonna find that muscle. Can I get you to turn your head just a little bit more? There you go. And so we got anterior cervical. We got the deep cervical. And we got the posterior cervical for your cervical chain. And then we got on this side, anterior cervical. We got deep cervical. And we got your posterior cervical. Now I'm gonna get you to shrug your shoulders for me. We're gonna check your supraclavicular lymph nodes. Okay, no lymphadenopathy felt. Okay, so now we're gonna go to your cranial nerves. And just looking at your nose is midline to your face. No signs of drainage. I'm gonna get my pen light just to check your mucosa. Mucosa is nice and pink. Okay. And your light does not shine through to the other side, no deviations. So I'm gonna get you to occlude one there and breathe in for me. Any difficulty with that? Other side. Okay, no difficulties. Now I'm gonna get you to do that again, but this time I'm gonna have you close your eyes and tell me what you smell.
Alcohol.
Okay, other side. Breathe in.
Alcohol.
Okay, great. So cranial nerve number 1 is intact. Now we're gonna do cranial nerve number 2. And with that, we're just gonna take a piece of paper and I just want you to read the first line for me if you can. Okay, so the writing may be too small for you, and I understand that we don't have our actual Jaeger card to test, and that is
Ask
okay.
about cough, shortness of breath, chest pain, smoking, respiration, infection.
Okay,
history.
that's great. Awesome, thank you. So a patient was able to read the first line. Normally that would be our Jaeger card test, but we don't have our Jaeger card, and we already did your Snellen chart. So your cranial nerve number 2 is intact. Next we're gonna do 3, 4, and 6. And we're gonna start by looking at your eyes. And just looking at your eyes, I can see that your sclera is white. Your pupils, your color around your pupils is brown. Can I have you look up for me? Your conjunctiva is a nice light pink, no excessive veins. Look down for me. Same at the top. I see one, deep vein, but nothing too excessive. Okay, great. And then looking at your eyes, I can see that your pupil size is a 4 on both sides. So now we're gonna use the pen light and check and see. Okay, so I'm just gonna go away from this side. Okay, pupils constrict briskly to a 3 from a 4. Okay, pupil constricted briskly from a 3 to a 4. So that was bilaterally. So now I'm gonna test your ocular movement, your extraocular movement. So I'm gonna have you follow my finger with just your eyes and not your head. We're gonna go here, out, down, down, over, and continue to follow my finger. And out. Okay, great. So pupils are equal, round, and reactive to light and accommodation. No extraocular movement, no nystagmus present. Cranial nerves 3, 4, and 6 are intact. So now we're going to test cranial nerves 5. And what cranial nerve 5 is going to test is the sensation in your face. We already checked your muscle mastication. So I'm going to have you close your eyes. I'm going to take something and rub across your face, and I just want you to tell me when you can feel it. Okay?
Okay. 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 Okay.
Okay, great. Cranial nerve number 5 is intact. Next, we're going to do cranial nerve number 7, which is still with the face. I'm going to have you smile. I'm going to have you frown. I'm going to have you raise your eyebrows. Puff out your lips. Okay. Puff out your cheeks. Okay, great. Cranial nerve number 7 is intact and your facial features are symmetric. Now we're going to go to cranial nerve number 8. We would normally test or look in your ear with the otoscope. And I would test, pull your ear up and back on the pinna and look in on both sides. And on the right side, the cone of light would be at 5 o'clock. Your tympanic membrane we would expect to be gray. And we would expect to sometimes see cerumen present in your ears. But since we don't have the otoscope, we won't do that today. And then on the left side, the cone of light will be at 7 o'clock. But we will do the whisper test. And so what I'm going to have you do is I'm going to have you bounce on your tragus or wiggle your tragus. And then I want you to just tell me if you can hear what I'm saying. We can try one more time.
Hot red apple.
Other side.
ABC.
Yes. Okay, so cranial nerve number 8 is intact. Now we're going to check 9, 10, and 12. And so I'm going to have you, or just looking at it and inspecting first. I see that your lips are nice and pink. They're really moist. No dryness or no signs of dehydration. I'm going to have you open your mouth for me. And looking inside your mouth, your buccal mucosa is nice and moist. It is pink. Can I get you to stick out your tongue for me? Your tongue is symmetrical. Can I get you to move it from side to side? No deviations, no tremors. Can I get you to hold it out and say ah?
Ah.
One more time.
Ah.
Uvula does rise. When you say ah, uvula is midline. One more time. Can I get you to say ah? Tonsils are a 1+. And we don't have the material to check your gag reflexes, so we would normally check your gag reflexes at this time. But we're going to say that cranial nerves 9, 10, and 12 are intact. And lastly, we're going to do cranial nerve number 11. So I'm going to have you shrug your shoulders for me. I'm going to have you put them down, turn your hair from side to side. Okay, now we're going to do it again. I'm going to test your strength, and you're going to do it against the resistance of my hand. So shrug your shoulders. Okay, turn your head to my hand. Okay, and now again. Okay, cranial nerve number 11 is intact, and your neck and shoulder strength is a 5 out of 5. So now we're going to check your neck. And just looking at your neck, I don't see any edema. I don't see any signs of lymphadenopathy in the thyroids just by looking. Your trachea is midline. And we're going to feel for your carotid pulse. Your carotid pulse on the left is a 2+. The carotid pulse on the right is a 2+. And then just to check skin turgor, there is no tinting present. Okay, so now I'm going to auscultate your carotid arteries. And I'm going to listen with the bell side of my stethoscope just to listen for bruits. Okay, so I'm going to have you take a deep breath in, exhale, and hold. Okay, exhale. Okay, take a deep breath in, exhale, and hold. Okay, breathe. No bruits heard. Okay. Okay, now we're going to check your thyroid. So I'm going to have you hold your neck up, and then I'm going to have you swallow for me. Okay, again. Okay. No lymphadenopathy felt in the thyroids. So now we're going to just inspecting your back as much as I can. Your skin is a tan color, which matches the rest of your skin, which is appropriate for ethnicity. Skin is warm and dry to touch. Sorry, I know my hands are a little cold. I don't see any scars or bruises present. So I'm going to just palpate. No crepitus felt. I'm going to have you say 99.
99.
Again.
99.
Again.
99.
Again.
99.
Again.
99.
And then I'm going to have you take a deep breath in for me. And breathe out. Okay, chest expansion is equal bilaterally, and tactile firmness is equal bilaterally with no increase or decrease firmness. So now I'm going to percuss. And we're going to just lift up the lining of the shirt. Okay. Okay, resonance endo sounds heard when percussing over the lung fields. Now we're going to auscultate. And as we auscultate, I'm going to have you take deep breaths in through your nose and out through your mouth. Okay, can I have you take a deep breath in? Again. 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 One more time. Okay. Breath sounds are clear. No adventitious sounds heard. Now we're going to check your CVA for tenderness. Any tenderness there?
No.
Okay. What about there?
No.
Okay, so no CVA tenderness present. So now we're going to come back around to your anterior chest. And inspecting the anterior chest. I see you have just one mole right there on your chest. No other marks or bruises, lumps or lesions, no edema. Okay, I'm gonna just feel. Okay, no crackness felt. Can I get you to take a deep breath in? Okay, chest expansion is equal bilaterally. Okay, so now I'm going to get you to say 99 for me.
99.
Again.
99.
Again.
99.
Again.
99.
Again.
99.
Again.
99.
Okay. No tactile firmness is equal bilaterally. No increase or decrease firmness. Okay, so we're not going to percuss over the anterior chest. So I'm going to go ahead and auscultate. And once again, I'm going to have you take a deep breath in through your nose and out through your mouth. Deep breath. Again. 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 Okay, breath sounds are clear. No adventitious sounds heard. So we're about to get started with the cardiovascular section. But before we get started, I just want to say that I forgot to mention that when inspecting your anterior chest, you were not in any distress. You showed no signs of shortness of breath or difficulty breathing. You weren't in a tripod position, and there was no nasal flaring. But now, just inspecting the chest and the for the cardiovascular section, I see no lips or heaves, and so I'm just gonna palpate for thrills. I'm gonna palpate at the base. I'm gonna go up under. Okay, no thrills felt. And so I'm gonna find your point of maximum impulse. I'm gonna check at your mid-clavicular line, 5th intercostal space. Okay, PMI, palpable. Okay. So next, what I'm gonna do is I'm going to percuss, and I'm gonna start at the axillary border, and I'm gonna percuss into the sternal border, and we're gonna do this the best we can. Okay. So that was a resonant sound over the lung fields with dullness over the heart. So now I'm gonna auscultate. We're gonna start at the second intercostal space on the right, which is the aortic valve, and the second intercostal space on the left, which is the pulmonic, the third intercostal space, which is Erb's point, we got the fourth intercostal space, which is the tricuspid, and then the fifth intercostal space, which is the mitral. S1 is 2 sounds heard in each one. Now we're gonna listen at the fifth intercostal space, mid-clavicular line, for 1 full minute at your apical pulse. And I'm gonna listen with the bell side so I can also listen for bruits. Okay, now. Okay. Your apical pulse was 72 and no murmurs were heard. Okay, so next we're gonna go to the abdominal section. But before we go there, I would just like to state that while doing the cardiovascular section, we would normally check for jugular venous distension in your neck, which could be a sign of heart failure if your jugular vein is distended. But because we don't have the proper bedding or equipment, I won't be able to do that. But I would normally raise the head of the bed between 30 and 45 degrees. I would have you turn your head to the left, and then I would put the ruler, my ruler, at your sternal notch, and I would take my piece of paper or something to measure from your jugular vein up into the ruler, and we would want it to be less than 2 centimeters. Okay, so now going to the abdomen. The abdomen is round, and I don't see any abnormal lifts with your abdomen. So we're gonna listen, or auscultate, I'm sorry. Okay, we're gonna start in your lower right quadrant, and we're listening at your bowel sounds. Okay, bowel sounds heard. Upper right quadrant, bowel sounds heard. Upper left quadrant, bowel sounds heard. Lower left quadrant, bowel sounds heard. So after bowel sounds in all 4 quadrants, I'm sorry, I still have to auscultate. Now I'm gonna auscultate your aorta. Okay, your renal on the left, renal on the right. Okay, iliac on the left, iliac on the right. And we would normally test your femoral also, but we won't do those today. But I heard no bruits when auscultating over those areas. So next I'm gonna percuss. We're gonna start in the lower left quadrant. Okay, tympanic and dull sounds heard while percussing over the stomach. So now we're going to palpate. I'm going to start with light palpations. We're going to start in the right lower quadrant. This is where your cecum is. In your upper right quadrant, this is where your gallbladder and your liver is. Then we're going to do the upper left quadrant. This is where your stomach and your spleen is. And then your lower left quadrant, where your descending and sigmoid colons are. And now we're going to deep palpate for the liver and the spleen. We may not feel it, but that's okay. Can I get you to take a deep breath for me? Okay. Liver not palpable. Okay, now we're going to try your spleen. Take a deep breath in and exhale. Okay, spleen not palpable. Okay. And so, while I have you, so now that we're done with the abdomen, we're going to look at your legs. Okay. Looking at your legs, your hair is evenly distributed. Your legs are symmetrical. And your skin color matches the rest of your body on your legs. So no sign of arterial or venous deficiency in your legs. Okay. Skin on your leg is warm and dry to touch. No edema. Okay, we're going to pull off your socks and shoes. Okay, patient has just a few marks from where her socks were around her ankles, but nothing to worry about. That's normal. Okay, so we're going to check your pedal pulses first. I'm going to start with your dorsalis pedis. Your dorsalis pedis pulse is a 1+. Next, we're going to check your posterior tibial pulse. And your posterior tibial pulses are 1+ bilaterally. Okay. So we would normally test vibratory sensation also here, where I would have a tuning fork, and I would test to see if you can feel the vibrations. But we don't have a tuning fork right now. So we're going to keep going down to check capillary refill. It's less than 2 seconds. Okay, so what I'm going to have you do is we're going to check the range of motion in your feet. So I'm going to have you flex your toes by bending, balling them down. Extend, straighten them up. Hyperextend, pull them back towards you. Okay, I'm going to have you abduct, spread them apart. Adduct, bring them together. Okay, and so now with your ankle, I'm going to have you plantar flex. I'm going to have you point your feet downward. Dorsiflex towards you. I'm going to have you rotate your ankles. I'm going to have you inversion, turn them inward. And eversion, turn them outward. Okay, great, great. Now I'm going to test to strengthen your ankles. So what I want you to do is push down on my hands. Okay, now pull up on my hands. Okay, great. Ankle strength is a 5 out of 5. Okay, awesome. So while I have you, I'm going to have you sit up for me. Okay, so while you're sitting up, I'm actually going to have you transfer to this chair. That way your legs are dangling and you don't have to support them on the floor. Okay, so we're going to start first by we're going to test your knee strength. So I'm going to have you pull back on my hands. Okay, great. Now push out. Okay, knee strength is a 5 out of 5. So now we're going to test your patellar reflexes and your Achilles reflexes. I don't have a reflex hammer, so I'm going to just use my hand. In here, I would not have to hit the reflex hammer on my hand. So I'm just going to Okay. Okay. So 1 plus bilaterally in your knees are your reflexes. Next, we're going to test your Achilles. So, okay. Okay, and your Achilles reflexes are 1 plus, and I know that could be because of the missing reflex hammer. Next, we're gonna do your biceps and tricep reflexes. So I'm gonna find your tendon with my thumb, and this time I would normally hit the reflex hammer on my actual thumb to check your bicep reflex, and then we're gonna do the same with the tricep. And we would hit the thumb with the tendon, with the reflex hammer to check your reflexes in your triceps. Then on this side, we will do the same. And I'm gonna always use my right hand because it's my dominant hand to hit the hammer. And I would also hit my thumb here. And then when I got to the tricep, I would also find the tendon and hit my thumb with the reflex hammer here. Okay. Great. So now I'm gonna have you stand up. Okay, and we're gonna move the chair out of the way. So lastly, we're gonna do our range of motion. The rest of our range of motions. So we're gonna start with the fingers. I'm gonna have you flex your fingers, extend your fingers, hyperextend your fingers, abduct your fingers, adduct your fingers, and I'm gonna have you squeeze my hand. Okay, hand strength is a 5 out of 5. Okay, next with the wrist, we're gonna flex, extend, hyperextend. We're gonna rotate. We're gonna ulnar deviate, and we're gonna radial deviate. Okay, full range of motion in the wrist. Okay, next with the elbow, we're gonna flex, extend, hyperextend. Okay, and now I want you to come back to flexion, and I want you to, don't let me pull you, don't let me push you. Okay, elbow strength is a 5 out of 5. Next, the shoulders, we're gonna flex, we're gonna extend, we're gonna hyperextend, and we're gonna circumduct. Okay, we're gonna internal rotate, we're gonna external rotate, and we're gonna AB duct, AD duct. Okay, great. And then we already tested this part of your shoulder strength. So I want you to hold your arms like this. Don't let me push you down. Don't let me pull you up. Okay, shoulder strength is a 5 out of 5. So now we're gonna do the spine. So I'm gonna have you flex by bending down and touching your toes. And we're just gonna check your spine to make sure that it is midline, no signs of scoliosis present. Okay, you can extend by standing straight up. I'm gonna have you put your hands here on your hip and hyperextend. And then I'm gonna have you rotate from side to side. And I'm gonna have you lateral bend. And then to the other side, lateral bend. Okay, great. And so you have full range of motion in your hands, wrists, shoulders, elbows, and your spine so far. So now we're gonna do your hip. So with the hip, we're gonna flex, extend, hyperextend. We're gonna do the same thing with the other side. Flex, extend, hyperextend. Bring it back. We're gonna abduct. We're gonna adduct. Other side, abduct, adduct. We're gonna circumduction, which is the hula hoop. Okay, great job. And now you can find something to hold on to. And we're gonna internal rotate, external rotate, other leg, internal rotate, external rotate. Okay, great. And now we're gonna test your hip strength. So I want you to step out against my hand. Okay, great, step in. Okay, abduct against my hand, and then abduct against my hand. Okay, great. Hip strength is a 5 out of 5. Next with the knees, we already tested knee strength. So we're gonna do flexion, extension, and on the heel, hyperextension, flexion, extension, on the heel, hyperextension. Okay, great. So your knees, you have full range of motion in your hip and knees as well. So now we're gonna test your gait. So what I'm gonna have you do is I'm gonna have you walk there straight. I'm gonna have you walk back on your tippy toes. Okay, I'm gonna have you walk back on your heels. And then lastly, I'm gonna have you walk that way heel to toe. Okay, great. Your gait is smooth and deliberate and steady. And so this brings us to the conclusion of our head to toe assessment. I want to thank you for allowing me the time to do this head to toe assessment. Do you need anything before I leave?
No.
Okay, here's your call light button, and if you press it, I'll be here as soon as I can. But thank you and have a great rest of your day.
Thank you.